Hey everybody, this is not Jimothy, and I just wanted to give you a little post-surgery update on how the pilonidal cyst situation is going. So just this past Friday, I went in and had the surgery done to remove the entire pilonidal sinus as well as the cyst part of it. Everything went very smooth. It was supposed to take about an hour, the entire procedure about an hour. I was done in about 35 minutes, and I can tell you the most painful thing about the surgery was them putting the IV in, so no pain at all, really. I was fortunate enough to have a doctor that was very knowledgeable about excising and just all around dealing with pilonidal cysts. He said that he did not want to have an open wound and just pack it with gauze because, one, the healing process takes a heck of a lot longer, and he does not believe in adding a drainage tube. So he removed it, cleaned up the area, and sutured the whole thing closed. Although leading up to the surgery, I did need the area drained, and I was put on antibiotics for about a week before the surgery. And he said that that was really to just make sure everything is cleared out of there. So when he goes in to remove the entire tissue of the cyst and the sinus and the tissue surrounding where the sinus is connected, he won't have to worry about there being any infection or having to give me more extensive antibiotics to ensure that it will not come back. So he was very thorough, and I deeply appreciate that, and I trust his judgment on how to deal with this. However, the only downside to sutures is that, yes, it does heal faster. However, during the time of healing, you have to pretty much do nothing because the sutures can easily tear. If you think about where it is in that area and how much that area actually is bent or squashed or stretched, just sitting or standing or walking, you have to be very careful or those sutures can tear open. So the past 4 days, I would say 4 or 5 days, 4 days, it's just been, I've been laying around on my stomach and on my side, and I am not somebody who can just sit around. I need to get busy. So it's been tough for me that way. But, I'm so glad to have the pilonidal cyst taken care of. I've had the pilonidal cyst for like 5 years, and I am just happy that it's done, and I'm in the last stretch of healing. And I talked to him about the reoccurrence rate. He said that getting the pilonidal cyst again is very unlikely. However, it is not completely impossible. He said that's about a 5 to 10% chance of recurrence. So it's not zero, but I like those odds. Another thing is that I am in zero pain. I'm not in any pain right now. I'm standing. I have a standing desk that I purchased before the surgery because I knew I would not be able to sit down, and I work from a computer. So initially I thought it was the pain pills that he had given me that had stopped the pain. But I've since stopped taking the pain pills. I only took about 1.5 of them. And I've felt no pain. And I actually felt in the area where there was the stitching, the sutures are, and I can't feel anything. It's completely numb. So I think that the nerves might have been severed there because the area around where the cyst was is numb. I can't feel anything there. So for the time being, that's an advantage. I don't know if those nerves will grow back. I don't know how that stuff works. But it is just on the topper part of the buttocks, at the lower, just at the base of the tailbone, where the spine connects, I should say. From there down to where the crack starts, it's pretty much all numb there. So I don't know if I'll get that feeling back, but at the moment I'm happy that I don't feel any pain there because I'm sure that I would initially be in pain. Either way, I'm glad that this part is over, the surgery part is over, and now I'm just in the recovery part. And just a message to those who are apprehensive or scared about getting the surgery, just know I was very scared. Trust me, I was, probably just as much as you are, if not more. If it helps you, I'm just gonna walk through exactly what happened once I got to the hospital. So when you first get in there, you just have to go to the registry, patient registry, sign in. You go and sit in another waiting area, and then a nurse will call your name. You go back. they just ask you a whole bunch of questions like, have you been drinking? Have you been smoking? Have you been doing all this sort of thing? Did you not eat for the anesthesia? Obviously, if you're watching this video, I'm sure you have enough sense to follow the directions of the anesthesiologist. And after that, they just put an IV in you, and that's the most painful thing. Then they roll you over to the surgery room. They put you on the anesthesia, which has a little bit of a sting going in, but the pain is like 2 seconds, and then you're out. Then you wake up, and when I woke up, I was actually coughing a little bit. And I asked the nurse next to me, I said, how come I'm coughing? And he said, well, that's because you had a tube down your throat. So you're gonna wake up, and if they do end up putting a tube down your throat, you're gonna cough a little bit, and that's natural. From what they told me, that's natural. And you're gonna go home from there. You're not gonna be able to feel anything down there because of the drugs, for one. And if you're like me and a couple days go by and you still don't feel anything down there, it's most likely because they severed the nerves. But you drive home, and then you just sleep it off for a long time, and then I'm sure if you were like me, you're very hungry and thirsty from the anesthesia. So just have some nice bowl of ice cream or whatever you're into, and just take it easy for the next couple of weeks. I actually just signed up for a Netflix. I've had one before, but I canceled it because I didn't feel like paying, and I'd watched basically everything I wanted to watch, and I didn't care for the new stuff that was on. But I just re-upped with a free 30-day trial, and been watching some funny shows and movies, and got a couple Steam games that I've been playing. Just been taking it easy, and that's just make yourself comfortable, because you're going to be laying around for a couple weeks, at the least a couple weeks. I'm doing pretty good, so I'm thinking that 2 weeks in and I'll be ready to go back to school, and this will be the end of it. All right, well, if you do have a pilonidal cyst, just know that surgery is the only way to get rid of it. There's a bunch of different home remedies that you could suppress it, but you are not getting rid of it that way. It's impossible. So the only way to get rid of it is through surgery. And I'm telling you this, it's very common. I suggest you first go to a dermatologist, because the dermatologist will know which surgeon would best be able to handle a pilonidal cyst. The dermatologist I went through recommended a surgical specialist, and he's been really knowledgeable about the whole situation. So there's nothing to worry about. I'll leave you with that. Thanks for listening, and I'll see you next time.